The first baby boomers are turning 65, and in the next 20 years, 1/5 of the population will be 65 and over. And while they say you're not getting older, you're getting better, your body might not agree. Tell me about it. Here to talk about baby boomers staying healthy and feeling young is Dr. Mitchell Freedman of the Rothman Institute. Doctor, good to see you.
Good to see you.
Thanks for being here. Appreciate it. Our aging population is a different population now, but in a better way, the more active. Talk about the aging population now. It's a unique thing now.
It is. If you think about it, we have the oldest population in the world, and maybe even in the history of the world. We have high demands. We want to maintain our activity. When we retire, we don't want to just sit in an armchair. And we have women who, more than ever, want to maintain their activity. Far different than my grandmother or even my mother.
What are they doing? Just working out more, or
working out, playing tennis, sports, golf.
All right. Well, there are 3 keys, you say, to staying healthy. What are those keys?
Well, I think it's important to keep your weight down, maintain a good diet so that you want to go out and be active. It's important to continue to be active, not simply to exercise on weekends, but to maintain some activity during the week. And it's important to do a lot of stretching and good body mechanics and continue to enjoy your exercise program, not just make it a sterile endeavor, but something where you're enjoying the fruits of your labor by being active and hiking or taking trips, etc.
Now, all these relate to each other. I'm sure they help each other out, all those 3 keys, correct?
They do. They do. If you feel better about yourself by keeping your weight down, you'll be more active. And if you're more active and not just exercising by doing sports or traveling, it makes it a lot more pleasant.
How much should we have our doctors involved with our lives, especially when it comes to our aging population? Should we make a point of it and not overdo it, but we should have our doctors involved, don't you think?
Well, I think a good doctor wants to be a part of their patient's lives, but not just control it. I want to teach my patient what to do, so they need to see me marginally, and then I want to be there for them if they need me.
What do you believe when it comes to like injections and therapy? I know a lot of guys my age now are getting like cortisone shots here and there, you know, taking care of some joint issues. They're doing the glucosamine, chondroitin type of thing. Your thoughts on that? Can you overdo that, or what's the plan? You
can overdo that. I'd like to teach people their own activities that they could perform without injections and medicines initially.
Like
and then the second stage would be where I'm thinking about injections if they can't get by without them.
I see. I see. Because I know I had cortisone when I was much younger, just one little teeny shot when I was much younger, and I was growing fast, and it seemed to work, but I hear a lot of athletes will get it now, and that kind of masks the pain, and they kind of damage whatever's wrong with them. Is that true? Do you find that true?
Well, it doesn't mask the pain. It decreases inflammation so that they can function, but they're not cures. So you buy that relief temporarily so that you can work on strengthening the muscles around the affected joint. For instance, a knee injection, I'll try to calm down inflammation so that person can exercise and hopefully feel better coming out of the whole affair. So that it's not just the injection giving transient relief.
Can we talk about my left hip after the show?
Absolutely.
Too many dunks when I was younger.
I never had that problem.
Doctor, thank you. Dr. Freedman, great information. For more on the Rothman Institute, go to cvsphilly.com and click on Talk Philly. We're going to take